Today, I wanted to share with you the most common prompts I enter into AI clinical decision maker tools in my primary care practice as a family nurse practitioner. Now, I primarily use two tools, Open Evidence and ChatGPT. I'm going to talk a little bit about those, and with every prompt, I will tell you also why I choose which one I choose and which one I choose. That was worded in an interesting way. And we'll also go over a third, Doximity GPT, which I don't really like right now, but I think is about to get really cool. So let's dive into that, shall we? And all of these prompts, you would obviously make like your own. I'm going to give examples of kind of what I type in my own practice, but you do you, my friend. Like I said, I work in primary care. I see newborn through end of life, but you make it however you want. Okay, so the first prompt we're going to go over is something that you can use in order to quickly summarize a learning point. Here is an example of a prompt. Please provide me with an overview of ankylosing spondylitis. Include the pathophysiology, risk factors, signs and symptoms, pertinent physical exam findings to look for, prognosis, and treatment options, both pharmacologic and non-pharmacologic. And for this prompt, I would use Open Evidence because I'm actually doing something that involves like patient care, and I want all of my assessments, treatments, all of that to be evidence-based and from guidelines, right? I want this to be data-driven, and Open Evidence is great at that. It is free, which is glorious. You need either an NPI number, so you need to be like a provider registered with whatever, I forget who you're registered for that, but it's fine. Or you need to be a med student, an NP student, or a PA student and prove that you're in school. So I don't know how you do that, but it's worth it. This is a great website. Open Evidence is a clinical decision-making tool that pulls all of its data from peer-reviewed journals, guidelines, and other textbooks and resources that are of an academic nature, pulls them all together, then gives you the resources like links to it at the bottom. So you can go back if you want to read more about the article or look into it a little bit more. It's glorious. It is by far the platform that I use the most. And it is the one I'm always going to reach for if it's something that is going to be very directing patient care, because I obviously want that to be data-driven, evidence-based, all of it. And what this will basically do for you is it gives you a brief overview. Sometimes it really overachieves and it gives you pictures and it pulls out specific tables from articles. Sometimes it doesn't do that. I do not know how it decides when it's going to be an overachiever or not, but whenever it is, I'm like, you go, Open Evidence. Look at you. The biggest con I would say of Open Evidence is it doesn't respond well. Sometimes it asks you, it's like, do you want me to do this for you as well? It gives you information and then it's like, hey, I can make this even better. Should I? And you say yes, and it doesn't. It just tells you something totally different. Like if we were talking about ankylosing spondylitis and it was like, do you want me to make you a compare and contrast table of that versus, I don't know, like arthritis? You'd be like, yeah, that's awesome. And then when you say yes, it's going to go on a tangent about like Lyme disease. And you're like, so it has room to improve, but it's pretty great. So like I said, I really like it and I want it to stay, and it's free. So we're patting it on the head and we're saying, you really tried hard there, my friend. And I do have something that's going to help us with comparisons later. So just sit tight. The second type of prompt that I really like putting into these type of search doodads is something that's going to help you with lab interpretation. So here's a sample. What are the differential diagnoses that should be considered in a 42-year-old female patient with Crohn's disease with the following lab results? And for this, again, I would choose Open Evidence because I wanted to kind of go through the data first. Although I will say, if this didn't give me a ton of information, I may put it over into ChatGPT just to give me a general direction. And then I could go forward and use that as a launching board to decide, is this a path I really want to go? And I like this for lab interpretations because sometimes you get labs back and there's a whole bunch of things that are out barely. And you're like, does this actually correlate with the underlying diagnosis? Is this putting together a bigger picture that I'm just not seeing because I haven't seen that pattern before? And it acts as a little bit of a lab assistant, which who doesn't need a lab assistant sometimes? But I do want you to keep in mind with this, with all of these, this is not giving you like an exhaustive differential list. Okay. If it doesn't show up on your search here, that should not be like, well, I'm done here. You should still use your lab references and whatever other resources you're doing, your expert colleagues. This is just kind of like a jump start. Maybe this could ring some bells in your mind and send you down a different path and just provide general direction, right? I use this a lot for anemia screening because I just, no matter how many times I look at an anemia flowchart, I've given up. I will never be able to understand which type of anemia comes from where. So all the time I type in their little anemia labs and it tells me, hey, it's probably this. I'm like, thank you. Saves a lot of time. Then I go and triple check, right? Because again, we're not going to trust everything we see on the internet, but it gave me a little bit, a nudge in the right direction. And with a prompt like this, you also could open it up to not just including like, here's the lab results. You could even type something in like, hey, here's the HPI, here's the physical exam findings. What are some things I might be considering? And just again, keep in the back of your mind, we never put patient identifying information into these, right? We take their name out, anything that could identify, and we don't put that into search engines, right? No. We certainly do not. Okay. None of this should be identifiable. The next one that I use so much is we're going to create a comparison chart. Please create a table that highlights the similarities and differences between osteoarthritis and rheumatoid arthritis, include assessments, symptoms, as well as treatment. And this I would use ChatGPT for. Probably wondering, why is ChatGPT on this list? This does not seem very academic or safe. Do you really want to say you use ChatGPT in court? No. That's why I'm using open evidence for some of the other ones. And I'm double checking all these facts, right? To make sure that they are legit. But Chat has a phenomenal ability to summarize information and compare it and charts. Okay. And charts are helpful for my brain, and maybe they're helpful for your brain. They've been helpful for a lot of my patients' brains. I can say that. And ChatGPT thrives at this. Okay. Also, side note, ChatGPT is getting a lot better at its medical information. Okay. A lot of times I just type the question I'm about to ask open evidence into ChatGPT just to see what it would say. And then I compare it with open evidence and they all say the same thing. And I'm like, oh, okay. But still, in court, I would not want to be like, found that on ChatGPT. So we're not using it for patient-focused things, but it's not bad. That's all I'm saying. Anywho, with the tables, I often will print things out for patients if it's something we're deciding between. A lot of time with treatment options, I will type in some different, can you compare and contrast these treatment options? I'll put it into a table for them. I'll print it out and I'll send them home with it. We'll take little notes on it. And then they can call me back in a little while and tell me what they have decided that they would like to do. We can do some shared decision making, and it just gives them a better visual representation of what we're doing going forward. I look at it a lot. I have a few of them that I just save and I flip through, like with rheumatoid arthritis and osteoarthritis, because when my brain's just like, which one is which? I can go through and be like, okay, that one has, these presentation and this one has this. Whichever one you get confused between, have it make you a table, print it out. Saves you a lot of time. And that leads us nicely into our next point of you can have this help you create patient education. So for our next prompt, please provide instructions for a patient on how to take levothyroxine. They will be taking it daily. Great. And you could say, these are the other meds that they're even taking, and it'll kind of give them a little bit of an idea of a schedule. Here, hey, here's the do's and the don'ts, the thing we want to avoid. Obviously, you could make this yourself as well, but it does a great job. It comes up with excellent teaching points. It puts it in like a really good, easy to understand patient language. And I have found it quite helpful for different things with teaching points. For this, I usually do use ChatGPT. It just is a little bit more patient friendly. I will then double check it with like Hippocrates or whatever else I'm using for like pharmacologic things. And I save it then to my computer as like patient instructions for this. And I have a ton of different templates saved on my computer. And then I print it out the next time someone takes levothyroxine. Obviously, if you're adding other meds to that they take it with, you won't be able to share that as much, but I just have it for all my different medications. Then I can just like, boop, print it. If your charting system lets you do that innately, where you could do like patient education per med, glorious for you. Mine certainly does not, but I have also, I think I have ones on, you could do this for like how to do an intranasal steroid, how to use an inhaler, what you should take oral iron supplements with, all of that type of stuff. Make it, save it, hand it out. You could also even do like over the counter type stuff for like, here's what I recommend for cold and flu. Here's the type of over the counter allergy treatments, anything you want to do patient education wise. They can help you summarize and deliver that information quickly if that is something that interests you. And with all of this stuff, obviously, like review it. Don't just hand it to people and be like, okay, good luck. The internet said it's fine. So here you go. Review it. You're going to have to tweak some of it, okay? So it's in your own language and it's how you want it to be, but it gives you a good frame to build your house upon. All right. Next thing I like to use it for is guiding learning in a new setting. So the prompt would look like this. What are the 20 most common diagnoses seen in primary care offices that care for patients from newborn through end of life? This is excellent. If you are getting a new job, if you're a student and you're going to be precepting in a new area and you're like, I don't even know what I might be seeing here. Or if you are a preceptor for a preceptee, you can email them or text them, however you're communicating with them, this list of like, here's 20 things that we see all the time, but you don't have to come up with it off the top of your head. You can kind of bounce the idea off the internet. I'd use ChatGPT for this. Again, this is not something that is patient facing. ChatGPT can have a pretty good idea of all of this, and it just gives you a really nice base. You can look up some treatment plans. You can look up some assessments, get a general idea of how to treat those 20 things or 10 things, whatever you think would give you a good foundation so you're not walking in feeling blind on that first day. Next, help with billing and coding. Don't we need all the help we can get? Here's the example. Please make me a table with common ICD-10 codes and CPT codes for a primary care office that sees patients from newborn through end of life. Again, ChatGPT because it makes cuter tables and it seems to know more about, since the other one, Open Evidence, is pulling from like peer-reviewed journal. It doesn't have like, it's like book smart, but it's not like world smart. ChatGPT is pretty world smart. So it seems to know these things better. It's just going to give you a list because for the life of me, I don't know, I've been doing this like 9 years and I still really only know like N39 and I10. So if you don't have hypertension or a UTI, I just really don't know your ICD-10 code. So I made one, I printed it, I laminated it because I'm extra, and I put it next to my desk. And that way when someone comes in with back pain once again, and I can't remember the code, I can look at the code. You could very much tailor this to where you work. You know, CPT codes for me are a lot of like developmental assessments, Q9s, but yours could be maybe you work on a lot of knees and you inject them with things. You could tailor that to you and you wouldn't have to look up the code every time. And that would save you a few seconds of Googling, but those seconds add up. If you want my copy of this whole list of all of these things we're talking about, all the prompts, and like my ICD-10 codes and my CPT codes that I use in my office, I do have them available in my NP binder, which is available down in the description and hopefully like a little banner down below. It's basically just my notes that I use in primary care. Again, a resource, not a full substitution for all of things in life, but just my primary care notes that I use all the time. That is where these all live. So if you want that list, you can go see mine or you can make your own. That'll be exactly what you need in your own office. Okay, moving on. Next, we would be assisting with charting. And here's the prompt we're going to use. I am a nurse practitioner writing a patient note following an encounter in a primary care office. The patient was diagnosed with a viral upper respiratory infection. For the note, please include expected duration, what symptoms to monitor, and which symptoms should prompt further evaluation, and what over-the-counter and home treatments they can use to manage symptoms. That's obviously quite complex. You could make yours a little bit easier. And I would be using Open Evidence for this because this is something that is patient-facing, and I want them to pull over-the-counter remedies from actual evidence-based guidelines and treatment recommendations. And this is something that you could save as a template into your charting system. Obviously, you could also just go and type them out when you write them the first time and save them that way. But I found that sometimes this elaborates a little bit more and they cover bases that sometimes my brain doesn't think to cover. And then I can just save them in my template in the computer and pull them over when I need them for future documenting purposes. If you have dot phrases, I don't have dot phrases because I have Office Ally, but if you have dot phrases, this will be a great way to make dot phrases. You could really do this for all sorts of different areas in the chart, right? It doesn't have to be just the treatment plan. You could be doing, hey, make me a list of review of system like statements for children, make me a HPI template for a annual gynecologic exam. It could be very helpful in making your templates, like if you're going to a new job or you're just trying to save time. Highly recommend. Again, you'll want to tweak it, but it gives you a good starting place. Next, clarifying lab and imaging orders. And the prompt would look something like this. Are there any other labs or imaging diagnostics that I should be considering for a patient with X, Y, and Z history and this HPI? And then I paste the HPI, removing all patient identifiers, obviously, every single time. Gotta be good about that. I would use Open Evidence for this because I want to pull from evidence-based data. It's patient-facing. We're looking for clinical guidance. This can be very, very helpful for deciding like which x-ray to order, right? Because sometimes you're like, I don't remember which weird angle of the knee I'm supposed to be looking at for this type of fall. And it can kind of give you an idea of where to go with that, what shoulder thing we're trying to see. Might want to see like, am I forgetting a lab? You know, you have your basic labs that you're thinking of, but is there an obscure one I should also be considering? This can kind of give you an idea of that. I might not even use half the time what it recommends, but it just kind of gives me a general overview and points me in a direction and helps me think of things I might not have thought of before if I'm feeling like this is not the run-of-the-mill case. And I appreciate that. Next, we're going to use this as our secretary. All right. Please write a letter of medical necessity for a 13-year-old patient to be able to wear a continuous blood glucose monitor and insulin pump while they are attending summer camp. The patient has type 1 diabetes, manages it independent, and requires the monitor to avoid hyper and hypoglycemia. I am the patient's primary care provider. I write a lot of letters, if you can't tell, for medical necessity. I spend a lot of time doing prior auths and writing letters like, please, per my last note, aka per my last email type of things where I'm like, please just read what I wrote. And I like to have sometimes assistance with this because, and maybe they can make it sound more fancy, which might get it approved more. I don't know. You could use ChatGPT for this. Open Evidence does have a note writing, but I found that it's a little bit too like robot-y. So I usually use ChatGPT for this. If it's a much more medical thing, sometimes I'll put it in Open Evidence first and then I'll take their letter and I'll put it back in ChatGPT. And I'm like, can you just make this sound like a human? It's like a little bit more normal normal. And then they do that for me, which is very kind. But I use this a lot every time because you have to write a lot of letters depending on what you do. What are we not going to put in here? Patient identifying information, right? We have to add that afterwards, but it'll do a lot of the heavy lifting for us. And for that, we are grateful. And the last prompt tackling today is pre-charting. Here's your prompt. I am a nurse practitioner seeing a 37-year-old female patient tomorrow for irregular periods. What are some HPI and physical assessments I should be sure to include in my visit? I would use open evidence for this because obviously we're doing something clinical. I don't do this as much anymore, I'll be honest, but I've been doing this for a little while. In the beginning of my career, pre-charting saved my soul, okay? Because I had no idea what I was walking into. Half the time when you walk in and you did pre-chart, something else comes out of their mouth anyway, but at least you learned what you would ask if it had been the actual concern that was written on the encounter when they called for the appointment. And it just gives you somewhere to jump off of. Hey, these are the questions you should think about asking. You could even put them in the HPI already. So you're just like reading from them in the computer and some assessments. That way you walk in with a little bit more confidence. Super duper helpful. And then if it's kind of giving you some ideas of differentials of things you should be thinking about, you could always go back up to that first prompt and ask it to give you an overview of what that is and what some of the treatment plans and other assessments are for it. And you can go down a whole new rabbit hole and go to bed even later. So fun times for you. And that's it. Those are all of my prompts that I have for you. Now, you can't leave until you hear the rules, okay? Because there's rules with all of this, okay? I think you know the first one. We've gone over it a few times. What can you not enter in these chat thingies? Patient identifying information. Say it with me one more time. We will not put patient identifying information into this. Good job. Second, is this the only resource you use? No, this is not the only resource you use. This is a tool. This is something we bounce off of, okay? You should still be using your own brain, your own other resources, up to date peers that are smart. You should still be using whatever guidelines and resources lead your practice. Still be doing that, okay? Double check your work. People are worth it. And now it's time for questions that I've decided you have, and I will answer for you. Are there other programs other than Open Evidence and ChatGPT that you can use for this? Yes, there's Doximity GPT, and it's also free. Bonus, and it's very similar to Open Evidence. To be honest, it's just a little bit uglier and it's clunky, but Doximity GPT just acquired Pathway Medical, which is an app that does a lot of this clinical decision-making stuff, and that was a cool app. I still really like that app, and if they're coming together, Doximity is I think you should just get Doximity for its many other features. Maybe I'll do a whole video one day on Doximity because it's quite nice for a lot of things. But I think now that they're combining powers, I might be using that more. So stay tuned. Download it and see what it's doing. It also pulls from peer-reviewed journals, textbooks, guidelines, all of that type of thing. They also have a writer, like a secretary in there. I forget what they call it, Doximity Write or something, where it will write you letters. So it's coming up. I think it's going to be up and coming. We're going to keep our eye on you, Doximity GPT. Next question I've decided you might have, is this replacing my up-to-date habit? So up-to-date is expensive, right? And my office doesn't provide it. So I have to pay a whole lot of money for it every year. And I have found as I've been using these, so far I'm still double checking with up-to-date every time I'm doing like clinical decisions going off of like Open Evidence and stuff. And I'm not finding a lot of errors with it. I'll be totally honest. So far I still have both and I'm still double checking. I don't know how that's going to go when I have to renew. Okay. Because $500 is a lot of money every year to be getting the same answers, but also I'm nervous to let it go. So I don't really know what I'm doing there. Have you let it go? If you're in that situation, let me know. Maybe I shouldn't admit that on the internet. I don't know. Anyway, I have it for now and I'm still using it, but at some point, who knows? What are the benefits of using a program like this? One, medical information through like journals and stuff is often very gate kept. And unless you join their journal and pay them money every month, you can't necessarily get the information. This kind of takes it and it finds it for you and it summarizes it, which is really nice. Or if you don't know where to go and find the information, you don't have to go hunt and peck and find each organization. If you don't have something like UpToDate, which is again, a huge cost barrier to entry, this immensely opens up the world of information to people, which I think is glorious. So it's increased access to care for my patients because I have increased access to knowledge. So bonus, it saves a lot of time. It does. And that's great. There's never enough time, especially in primary care, probably wherever you work too, but I'll take all the time saving that I can possibly get. Third, when it's used responsibly, it has increased my knowledge a lot. It has helped me diagnose things that I really would not have had on my radar before because it's connected dots for me. It's allowed me to have a lot more informed conversations with specialists because I can kind of put all these different differentials together and figure out which seems most plausible, but have a very informed conversation with people when I talk to them versus before I was kind of like, I don't know where to go now, what to do with this patient when I'm calling them. And now I can be like, do you think it could be this? And they're like, oh, maybe on the other end, they're like, what are you reaching for, crazy lady? But I'm going to tell myself that some of them were impressed that I was like, could it be this by chance? And sometimes they're like, yeah, it actually could. So we're going to hold on to those moments and not maybe other ones. Fourth, it has increased access of a lot of patients to better care. So I currently live in a really well-resourced area. That has not always been where I have practiced, right? And a lot of people have, so either there aren't specialists that they can get to, or they can't afford to go to a specialist, right? Because if they have a high deductible plan, it's going to be like $300 or $400 to pay out of pocket to go to them versus the $125 or $150 it's going to be to come see me. Okay. It's much more affordable to see your primary care than a specialist. And for a lot of people, there simply are not specialists to go to because they live in a rural area and none of the specialists live there. So it has given access to be able to research things in, like I said, a more accessible way where ideally, obviously, you would be able to refer more complex cases to specialists, but I have heard of people who are in situations where they're like, if I don't give them care as a primary care person, like they're simply not going to get it. And I have talked to some friends who said that this has given them a little bit more confidence and ability to proceed, obviously, through this not ideal situation, be able to provide better care for their patients, right? When you're in that situation where the person either doesn't have insurance, can't afford the care even though they have insurance, or lives in an under-resourced area. So I think anything that increases access to patient care when used appropriately is glorious. So overall, in a nutshell, I just think it provides more information. It makes things safer when used well, right? When used well is the key here. So let's talk about what happens when it's not used well and what are some of the cons with this. I could see people getting a little bit too dependent on it, right? I could see people using this to totally drive the ship rather than to be like a little helper along the way. I could see people really just making all of their clinical decision making with this. And that I fear that I could see that going poorly. I think collaboration with other people within the healthcare space, making sure you're using a variety of guidelines and evidence is what's going to make you the safest practitioner. I could see it reducing people's likelihood to walk down the hallway and be like, hey, what do you think of this, to their colleague, or to call a specialist when they have something like this in their pocket or on their computer. And that's definitely a con, because I think it's always good to get experts in fields and just your peers' ideas, right? All of our noggins, when they come together, are better than one. So I could see that being a little bit of a problem. And also, it's going to make mistakes, right? AI hallucinates. We know that it does that. And if we're using something that can literally make stuff up, you don't do that with patients. So that could be potentially quite problematic. I always keep in the back of my mind, right, when I'm thinking about these situations and I'm like, oh, I'm not sure about that. Do I really want to double check it though with like a different resource at this point? I imagine myself having to defend that choice, and I wouldn't really want to be like, I used ChatGPT for this, or I used, an AI chatbot. So that's what scares me. Wanting to keep people safe, obviously, but also court being sued scares me. So keep that in the back of your mind. And then the other big thing is the environmental impact of using AI, which I'm sure some of you have already written me about in the comments while watching this video. So pretty much my big stance here, I am not an expert on how this affects the environment. Pretty much all resources that I use right now as clinical resources come from the internet, because my other big one is obviously UpToDate, which is also using, I'm assuming, water to like deal with servers. I don't know if this is different. I am aware that using something like this with servers, they have to keep them cool. It uses like water and produces emissions, and it can increase the humidity and impact the environment. And I don't know how to balance that with the enormous benefit that I have seen when providing healthcare to my patients. I don't know how to solve that moral quandary. And I've settled on, I am helping save/improve people's lives and keep them safe. So I guess that's okay. But like I said, I am not the ethics police on this. And if that doesn't sit well with you, then don't do it. Everything is kind of a cost benefit. And I am not an expert on the environmental impacts on this. So I can't say a whole lot more than that, but I did think I should at least mention it, because I'm sure some people will. I don't know. I'm sorry. If you know a lot about that and you have big feelings, feel free to engage below and share them with us nicely, please. And yeah, that's pretty much the lesson that I have for you, the questions I thought you might have. And now I have questions for you. Okay. Do you use AI clinical decision-making tools? If so, what are they? What do you like about them? Are they free? We love free. Do you know of other secret ones that I don't know about? I would love to hear about them, and the class would as well. If you have prompts that you particularly like and you find helpful, please share them down below. I am not the best prompt writer. It's taken me a while to narrow these down, which is probably embarrassing. So if you have other ones that you like, please share them with me because it might take me 5 more years to think of more. And like I said before, if you're interested in getting this list here of all of these AI prompts, a comparison of the different AI tools, as well as my ICD-10 code and all sorts of other notes that I have from my own primary care practice that I use day to day, that will be linked in the description down below. And finally, the most important point, when addressing the AI and asking it to help you with these things, always say please. We never want to get on AI's bad side. So use your manners, okay? All right, that's all I have for you for class today. I hope you remember that you, my friends, are enough. You are not alone, and you can do hard things, like figuring out how to use new technology and chat. All right, friends, have a great day. I'll see you next time. Bye.